Welcome, I'm Dan Holscher with Senior Mark, and if you're joining us today, it's because it's that time of year again. It's the Medicare annual enrollment period. This year's enrollment period, just like other years, runs from October 15th to December 7th. Today, what we want to do in this video is we want to compare. We get a lot of questions about what are Medicare Advantage plans, how do Medicare Advantage plans compare to traditional Medicare, the pros and cons to both sides of the fence. So we're going to compare Medicare Advantage plans, which are also known as Part C of Medicare, and we're going to show how they compare to traditional Medicare when it's paired with a Medicare supplement. A lot of the commercials you'll see on TV this fall, when they talk about a Medicare Advantage plan and they're comparing it to traditional Medicare, they're comparing their plan to just Medicare alone. They're not comparing it to traditional Medicare when it's paired with a secondary payer like a Medicare supplement. Keep that in mind, because when you pair traditional Medicare with a supplement, the coverage is much better. And that's what most people have done or do, is they have both traditional Medicare as the primary payer and the supplement as a secondary. So when they compare, they sound better than what they may actually be. What are Medicare Advantage plans? Number one, they're an alternative, and thus they replace traditional Medicare. You don't have traditional Medicare paying first and then your Medicare Advantage plan paying second. You just have your Medicare Advantage plan. The payer is being transferred from Medicare being your payer of your health claims to the private insurance company paying your health claims. So in other words, it's a single payer plan as opposed to a primary and secondary payer plan like Medicare plus a supplement. Keep in mind also that no matter whether you go with traditional Medicare or a Medicare Advantage plan, you still have to pay the $185 monthly Part B premium. So just because you go to the Medicare Advantage plan, you don't get out of paying that premium. So that's a steady between the two plans, as the $185. So how do they differ from traditional Medicare when traditional Medicare is paired with a supplement? So when we look at premium, traditional Medicare with a supplement, like we said, traditional Medicare is $185 a month and Medicare Advantage plan is $185 a month. So we're going to ignore that premium because it's the same on both plans. So the premium with a supplement is going to cost you $125 a month or more depending on your age. So somebody 65 will probably be paying $125 a month. Somebody older could be paying $200 a month, $250 or $300 a month. With a Medicare Advantage plan, they usually have a very low premium, in many cases a $0 premium. Provider choice, that means can I use my doctors and hospitals that I want to use? With traditional Medicare, there are no networks. So you can use any doctor or hospital that accepts Medicare, so you have a very wide choice in who you can use. With Medicare Advantage plans, they are going to be network plans. So they'll be HMO or a PPO, that sort of thing. You will have to just make sure that your doctors and hospitals are in network so that you can use them. Now, when it comes to medical benefits, traditional Medicare paired with a supplement is going to provide you with better benefits than a Medicare Advantage plan. And that's because you have traditional Medicare as your primary payer, and then you have your supplement that is paying what Medicare doesn't pay. If you have a Plan G supplement and everything you have done is Medicare approved, after Medicare pays and your supplement pays, you might have a medical plan where you're only out of pocket for the year is the Part B Medicare deductible of $257 for the year. So you could have an absolutely catastrophic year and only be out of pocket $257 on your medical benefits. With Medicare Advantage plans, they are going to have less benefits. With these plans, and we'll get to this next, you're going to have copays and deductibles and coinsurance based on what you have done for the year. When it comes to predictability, traditional Medicare is going to provide you with more predictability because you know what is paid. When it comes to Medicare, Medicare is very good at not really challenging what you're having done. As long as it's medically necessary, they're usually very good about paying what they're supposed to pay. And then your supplement just follows Medicare. So if Medicare says it's approved, the supplement's going to pay for it. So again, it's very predictable. With Medicare Advantage plans, not so much, just because it's a network plan. So the insurance company will have a little more say in what they approve and don't approve. So when you have a procedure done, you have to find out first if it's going to be approved. And then if it is, there's usually going to be a copay or, like I said, a coinsurance, maybe a deductible that's involved in that procedure. When it comes to prescription coverage, that's not included in traditional Medicare or a supplement. So you have to go and you have to pay additional premium for a standalone drug plan in order to have prescription coverage under that option. With most Medicare Advantage plans, they roll your prescription coverage right in with the plan. So you do have prescription coverage with your plan automatically. Now, when it comes to ancillary benefits, things such as a dental coverage, vision coverage, traditional Medicare is not going to cover those things. Now, it will cover medically related things. So if you have cataracts or glaucoma, Medicare will pay for those things, but it's not going to cover preventative dental, preventative vision, and the sort. Medicare Advantage plans will cover those type of benefits. They'll have dental coverage, vision coverage. Sometimes they'll have an over-the-counter card where they'll give you so many dollars per quarter to spend on over-the-counter items. So they have those benefits. Just be careful because there's a lot of restrictions with those. For instance, they may have dental coverage, but a lot of times they don't have a lot of in-network dentists in our area. So it's possible that in order to get the benefits, you may not be able to use your dentist. But you just want to make sure those ancillary benefits are worth, the difference between having the better coverage with traditional Medicare and the Medicare Advantage plan. Now, when it comes to what Medicare Advantage plans look like, this would be an example of a PPO plan. This particular plan would have a $0 premium for the plan. Again, you still have to pay your Part B premium of $185. But as you can see on this chart, there are going to be co-pays, co-insurance, and out-of-pockets for everything that you have done. So in this plan, for instance, your family doctor might be a $0 copay. A specialist might be $40. Any diagnostic testing might be a copay between $0 and $300. Outpatient surgeries are going to have a copay. An inpatient hospital stay is going to have a deductible period. For this plan, you might have to pay $400 a day for the first 5 days you're in the hospital. And then there's copays for all the other stuff. Now on the PPO plans, most of these plans, Medicare Advantage wise, will cap your out-of-pocket spending. So this particular plan has a $7,000 max out-of-pocket for the year. Could potentially be as high as $10,000 if you have to go out of their network. So when you do go out of network, which a PPO plan will allow, you're going to have to pay higher out-of-pockets to do that. Now we're seeing for 2026, some of the previews we're seeing of some of the plans. We don't have specifics right now, but we are seeing some of the benefits like the ancillary benefits we talked about before being reduced. And we're also seeing out-of-pockets being increased potentially. So this is an idea of kind of what to expect if you have a Medicare Advantage plan. So what are your options? Well, you have two choices. Number one, you can go with traditional Medicare and pair it with a supplement and a prescription drug plan. So you'd have a primary and a secondary payer plan. Or you can go with a Medicare Advantage plan, which is just a single payer plan. Now, the big question is, which option is better? Well, it depends. Nobody can truly tell you one is better than the other. The plans are just different. The key is knowing what you're getting and being happy with what you have. A lot of times people have plans and they don't really even know what they have. We've had people on Medicare Advantage plans who think they still have a supplement. So it's important to know what your benefits are so you know you have a plan that you're going to be happy with going forward. So things to consider when you're going to make a decision is your current and future health. You want to look at your current health, and even though nobody can predict the future, maybe you have a family history of chronic illness where you utilize your doctors and hospitals a lot. In those cases, you would probably be better off with traditional Medicare paired with a supplement because you have less out-of-pockets when you use your services. You want to look at your budget. Not everybody can afford a $150 or $200 a month premium. So in those cases, if your budget won't support traditional Medicare and a supplement, you may be able to go with a Medicare Advantage plan and save on premium. Provider choice. How important is it to you to make sure that you can always use your doctors and hospitals? Because with a Medicare Advantage plan, you're going to have to look at their networks and make sure your providers are in their network to use them. So if provider choice is highly important to you, you may be better off with traditional Medicare. If you're okay with using another specialist in certain circumstances, you may be okay with a Medicare Advantage plan. Ease of use. Like I said before, with traditional Medicare and a supplement, very predictable. You know what your benefits are. Usually your doctor knows what's covered by traditional Medicare before you even leave the office. With Medicare Advantage plans, there may be approval processes, and they could possibly say you can't stay in skilled care more than 3 days, and you have to go out and then you have to go through that whole appeal process. So ease of use is important. And finally, travel. If you travel a lot, Medicare Advantage plans may not be for you. I can't say they can't be good for you, but with Medicare Advantage plans, once you leave your home state, they only have to cover you in the case of an emergency. With traditional Medicare, you can go to all 50 states and they will cover you just like they do in Ohio. So if you travel a lot, you may want to lean to traditional Medicare. Now, during this time of year, you need to keep your eyes open and be aware, because there's going to be a lot of sales practices that are less than ethical. So you want to be careful. There's going to be fraudsters, hackers that are trying to get your information. Do not give your personal information to anyone calling you. Scammers are very good at knowing possibly where you bank. They might even know a local employee at a bank. So even if your bank calls you and it's someone that you think you know, don't give out personal information. So just make that a rule of thumb. Don't ever do that. Do not do business over the phone with somebody you do not know. This time of year, there's going to be a lot of Medicare phone calls you're going to get, and they're going to be talking about Medicare benefits you're missing out on, all kinds of things. So do not do business over the phone. Do not fall for the promise of getting Medicare benefits you're missing out on. This is a sales ploy that salespeople are using to make you think you're missing out on some traditional Medicare benefits. When they are talking to you about ancillary benefits you're missing out on, they're talking about a whole nother Medicare plan. A lot of times they're Medicare Advantage plans. You may get that benefit, but they are also changing your underlying medical benefits. And sometimes that's a dramatic change. So you may be getting a $150 grocery card and potentially giving up $5,000 to $6,000 in medical benefits every year. Finally, do work with a local agent you can trust. Whether that's our agency or somebody else that you work with, we highly recommend you work with them versus somebody over the phone, because we've had a lot of experience with clients who got a phone call, thought they were signing up for an extra benefit they were missing out on, only to find out after it was too late that they had a whole different health plan. Like always, we appreciate your business year to year. If you have questions or you do need help, get a hold of us. We'd be happy to help you. Our phone number here is 937-492-8800. Thanks for joining us.